Good afternoon and welcome to Conversations on Health. This, what is it, October 29th edition in this 2025 year. My name is Natoya Johnson Chapman. We are live at Wilson's Music Center here in Marys Hill, Tobago, and we are going to have a conversation on health with Dr. Keny Bastien, world renowned, if I may say so myself. Dr. Bastien, good afternoon and welcome. Can you hear us? Or can you hear me?
Good night, Toya. I greet all to this program. Yes, I can hear clearly. Yes.
Great. Welcome to another edition of Conversations on Health. I know the last time
Mhm.
you and I were on this platform could have been about 10 years ago. So I'm
Yep.
really elated to be here with you once again to share with your wealth of knowledge and information on health and living a healthy life. Are you hearing me, Dr. Bastien?
Indeed, I understand as a group of our community. Yes, I can hear you very clearly. Can you? Can you?
I'm hearing you now, yes. Right?
Because I can hear you very clearly.
Excellent. So give our
Yeah.
audience a reintroduction of who you are and, the information, your designation, the full works. I mean, not the catalog. That might be the entire program, but a synopsis.
Well, a synopsis. The purpose of this, I've been in the field for 45 years. And I practice in Belgium, in France, and in United States. I have patients all over the world, in Switzerland, in Portugal, and in Paris until now. And I have patients all over the Caribbean, Tortola, St. Martin, St. Lucia, uh, Tobago,
Yes.
Trinidad, you name it. They are all over Curacao, Anguilla. Oh, I've been in all those places and giving symposium and lecture. And I've met doctors, universities, scholars, and I've been in the field myself, as I said, for 45 years, and I've 18 years of university training. And I'm a cognitive psychologist. I got a master in cognitive psychology from Mont State University. I'm a medical doctor from Open International University for complementary medicine. And I have a bachelor degree in orthomolecular nutrition from Donsbach University that has been transformed into UNE, International University for Nutrition Education. I have many certificates, and actually, I'm going to a process, international process, and you're going to God is going to reveal something massive to the whole world and to a lot of criminal people out there. Because there are many things that we need to learn. You see, the system, the Western system, has been trying to shut down the truth about the real science of medicine. And if you remember, when the COVID saga took place, Bill Gates didn't vaccinate his children, and he said that openly. But he encouraged all people to vaccinate themselves. And 4 years down the road, we end up now with a lot of people dying in Tobago because the government forced them to be vaccinated. Those who didn't get the vaccine, they are still doing good. But those who got the vaccine now, they are end up with a lot of cardiovascular complications. And now the opportunity for us is to bring the fact that, particularly the people in Tobago, we are extremely blessed, and that's why I love Tobago. Uh, Tobago is extremely blessed to have a diversity of plants, medicinal plants.
Yes.
If the people had that information, they would be able to use those plants and discard to a large extent. I don't say completely, but I say to a large extent, all the drugs prescribed by Western medicine. What we need education. And that's what I did myself too. Is practicing medicine is not the smartest thing because if you get a symptoms, you go to the doctor, the drug that you receive doesn't work, you have to go back. But if you are educated, not only you're going to understand the symptoms, but also the functions of the body. And that's the beauty of what Natoya and I do. Natoya has a knack to ask the right questions. And she put herself in the place of the general population. Because she has that level of empathy. She's an empathetic lady. So in that sense that she can put herself in the place of the general population and ask the question that everybody has in their mind. And I love that type of interaction. And I think I want to give glory and praise to my God to make it possible that we can join forces, bless the people with that educational program. You see, the conversation is about
Excellent.
health education. So I hope that my approach is educational health protocol. It's not possible. Nobody can treat any disease. And when somebody tell you that they're going to give you medical treatment, they are just fooling you because you cannot provide a medical treatment to that body. The body is too sophisticated. The body is set up in such a way that's the body to heal itself. What
Absolutely.
you need to know the avenues to be used to bring in the nutrients that the body needs to do its job. And that's why it's so important to put the emphasize the the functions and the nutrients that are needed. So
Excellent.
that's what we intend to do. What we intend to do in that series, I didn't mention that to Tantoya in our conversation. We will do our best to suggest to bring to the people the simple recipes that they get in their environment that they can use, they can apply in their environment to treat common ailments.
Yeah.
You see, when you get the flu, people with diabetes, people with high blood pressure, people with arthritis, people with migraine headaches, people with painful menses, people with depression, all those common things, and particularly now that the economy is really bad, and you have a lot of people, they are liars. They pretend to have a training they don't have. They
Mm-hmm.
pretend to have an education they don't have. And a lot of people are following them, listening to them, but they don't have the qualifications. Me, 45 years, 18 years of university training.
So you're ready. You're ready.
And yes, and I've been doing what I do now for 40 years. So
Excellent.
here I am standing and giving glory to God because the God that I serve is a living God, and
Amen to that.
and and the way we go, that's the way He wants us to go. You know, people need to be educated. God want to take control of our soul. God want to be in charge of our lives. But for that, we need to know the laws. We need to understand the body functions. We need to be humble enough to release our pride and to humble ourselves to learn and to get all the benefit. God wants us to be well, but He wants
Absolutely.
us to be educated. Proverbs says, with everything you get, seek knowledge.
Absolutely.
Seek
Absolutely.
seek knowledge. So
Absolutely.
that's the purpose
So
of that conversation.
Excellent. So, where do we start today? What are we going to look at today, or what are we going to talk about today, or expound on, should I say?
Well, as I mentioned, there are a lot of common ailments that we suffer from,
Yes.
and there are simple recipes. For example, today, I could consider the fact that you have disease like cancer. You have mononucleosis, we call it the kissing disease, and you have leukemia, which is the cancer of the blood. Okay. How many people know that there is certain way dandelion to shut down leukemia? How many people know about that? And do you know there are studies, monographs that have been made in Germany referring to dandelion, the use of dandelion, huh? Dandelion
And
to
dandelion grows
reverse.
wild right here in Tobago.
Exactly.
Yeah.
It's all over the place.
Yeah.
And did you know that the same dandelion, that's what I said, come on, a lot of people are dying with the COVID vaccine. Do you know that that COVID vaccine, what's wrong with the COVID vaccine? It's because they inoculate you the graphene oxide. The graphene oxide goes to the gene receptors to program the gene to produce what we call spike proteins. And the spike proteins supply so rapidly. Now, you see, after they give you the vaccine, they go watch you. Some of us, we die the first
Yeah.
month.
Yeah.
It's not the first day or the first week. Some of us will die 4 or 5 years down the road. It has to do with the diet we adopt, we follow many things. The strength of your lifestyle, and of your beliefs. Many of us. So that's why there is since the vaccine, there is a big trend of death taking place in Tobago, and the doctors. There is not one day in Tobago, and that uh, saddened me deeply. There's not one day in Tobago that somebody is not dead from the vaccine. All right. So when they take them to the emergency at the hospital is not equipped to address the situation. And many doctors die also. Many nurses die of the vaccine. So, as I say, the reason it happens like that is because of the inoculation of the graphene oxide. The oxide take control of the gene, and your gene begin to reproduce the spike protein, and the spike protein trigger an agglutination at the level of the blood vessels. So you have a lot of platelet formation, a lot of plaques, and that could we call a congestion. And that congestion of the blood vessels, a lot of blood clot formation, uh, obstruct the circulation of the blood, and the blood become extremely viscous, and the brain, it become extremely difficult for the brain to receive the amount of oxygen needed. So you start suffering from chronic hypoxia, and because of that coordination of the activity of the nervous system cannot take place properly. So you end up, because of the blockage of the arteries, you end up with cardiovascular issue,
Yeah.
and a lot of people dying with heart attack, with stroke, as a result of the proliferation of the spike. Now, you see, I'm talking about simple recipes that you have in Tobago. It happens that the dandelion I'm talking about, dandelion can be used. You can juice it, you can eat it, because dandelion is overload with proteins, with trace minerals, and there are specific molecules that are going to block the receptors of the graphene, so that when you have dandelion in your system, the graphene oxide cannot take control of your genes. Strongly encourage everybody to do a culture or to cultivate the lion and to sell it. Because do you know, if there is a period of scarcity and famine, when food, the dandelion itself is a whole food, it's complete. It will provide you with the protein that you need, it will provide you with the carbs, and it will provide you with essential amino acid and essential fatty acid.
In a
It's a whole,
balanced way.
yes, it's a whole meal. And on top of that,
Yeah.
as I was saying, it provides you with all the nutrients that you need to build. It's a blood builder. Dandelion is a blood builder. When you suffer with chronic anemia, a lot of people that suffer with sickle cell anemia, the sickle cell anemia means that the hemoglobin presents a shape S that prevent it from capturing the oxygen, the copper that are needed and also the B12, those are needed to carry the oxygen to the brain. Well, guess what? The dandelion come in the picture and correct the shape of the hemoglobin. So a lot of people that are juicing just the dandelion, those people, they will not suffer from the regular symptoms of the sickle cell anemia. Interesting,
Yeah.
and there are a laboratory. There's a laboratory in United States, Metagenics, that come up with one product. Uh, I have this product in my repertory. It's called Vitalis. It carries the name of my company. Vitalis is the type of nutrients, when you take it, it presents to the blood cells simultaneously the set of nutrients that can change the shape of the hemoglobin S, the sickle cell. That is the symptoms of the sickle cell anemia. Well, dandelion does the same thing that Vitalis does, dandelion does it. And we have it at your feet. You use it as weed. That can change completely. So we have the benefit that a lot of common ailments like that, sickle cell, leukemia, eh, let's say even pernicious anemia that has to do with a deficiency in vitamin B12. Febrile anemia, which is different from pernicious anemia, is when you can't capture your iron. So you're going to look for your iron. Guess what? Dandelion gives you your iron. So many problems that we could easily solve if we only had the knowledge. So that's why it's extremely important to have that type of conversation. And
Absolutely.
now, in association with this, Natoya, there is a conceptual approach that is extremely important that we call the biochemical individuality. The biochemical individuality means that when you go to the doctor has a set of, according to the pharmacopoeia, pharmacology, there is a set of drugs that you have, and you actually which dose use so that the person can reasonable use of the drug. And that is called the RDA, recommended daily allowance. The RDA is recommended daily allowance. So there are certain concentration of the drug have basis. It cannot go beyond, and that has to do with the height, the weight of the person, and the gender, because you have to take into consideration aspect. That's what we call the biochemical individuality. But in our case, we take into consideration what we call the blood type. We take into consideration the blood type. The blood type is extremely important because according to your blood type, there's that you can process or that cannot process. It's universally known. According to your biochemical individuality, a blood type, you are prone to use a protein diet. A protein diet is more suitable to somebody with a blood type O positive. All right. So those are facts that relate directly to the concept of biochemical individuality. Now, this concept of biochemical individuality also refer to the amount of carb that you can consume on a daily basis. Your biochemical individuality detect according to your biochemical, what we call, according to your metabolic profile. We will come back to that. This is very serious. But according to your metabolic profile, you can be the type of person that can use a lot of carb. According to your metabolic profile, another person can use a lot of protein or a lot of lipids. All those details are important. Imagine that you are you have a profile that capacitates you to use a lot of carb, but you are a person that loves meat because your family loves meat. Are you going to poison yourself? The meat tastes good in your mouth, but your body cannot process it because that's not your metabolic profile. It doesn't correspond with your metabolic profile. And that's why a lot of people, they develop disease that they can't control, because if you belong to a certain profile and you eat a certain type of food that is not compatible to your metabolic profile, you're going to generate a lot of metabolic waste. What do I mean by metabolic waste? Let me give you an example. A profile is good for protein, and you eat a lot of bread. Bread is a carb. Bread is a polysaccharide. The saccharide is going to generate glucose, and you need to break down that glucose. When you break down that glucose, how do you break it down? You can break the glucose in two phases, aerobic phase and anaerobic phase. If you break down that glucose in anaerobic phase, you're going to overload your system with metabolic waste. What do we call metabolic waste? Triglycerides, ethanol. Ethanol. You don't need ethanol in your system. And if there is a reasonable concentration of ethanol, your liver will be able to process it. But if your liver cannot process, if you are somebody that eats a lot of bread, a lot of rice, a lot of sugar, well, you're going to produce a lot of triglycerides, a lot of cholesterol, and a lot of ethanol. And your liver will become cirrhotic as a result of a diet that doesn't correspond to your metabolic profile. I hope that you understand that aspect, that detail. And that's why a lot of us, we keep going to the doctor and no result. Because the doctor himself, he doesn't know nothing about that. Nothing. He doesn't take into consideration your metabolic profile when he's prescribing his drugs. You cannot blame him for that. No, because the doctor must function within what we call the hospital standard procedures. Hospital standard procedures refer to what? To what? It refers to pathology, semiology, and pharmacology. That's all. That's all. That's how far it goes. And then the drug must be prescribed. As if you don't pay attention to that, the doctor can become a sophisticated drug dealer.
That's what
Well,
a lot of
but
them
that's why it's
are,
so.
a drug dealer.
Yeah, but
They
that's
get
it.
quick
They are
fix.
Yes, sophisticated drug dealer. So you
Yes.
see that conversation. Let's go back to our dandelion that we have
Yes.
everywhere in
But
Tobago.
before you go back to that, in you always talk about polysaccharides, and you know, for the regular air, and let us understand what that is and what it
Okay,
means and what they are.
that it means.
Yes.
Okay, polysaccharides belong to a family of, we call that a, it's a, what you call, it's a polymer. Well, I have to use the word, the chemical words. Polymer is a long
Break it down
chain
as much
of
as
a,
you can.
I'll do that. You see
Yes.
sugar. When you say sugar, you say glucose.
Right.
Glucose, that's the name of it. That's what sugar is. When you have a long chain of molecule of glucose, that's what we call polysaccharides.
Right.
A glucose is a monosaccharide. You see, a, one molecule of glucose is a monosaccharide. And when you have a lot of that, what we call polysaccharide also is starch. What we call starch is what we call polysaccharides.
Yes.
So that's starch. When you have a lot of starch, don't you see when you have to iron your shirt, you have to use starch? All right,
Yes.
the same thing. That's the same
Right.
thing we produce in our body. That glue, that shape up, okay, your clothes, your shirt, that's the same glue that you introduce in your digestive system when you eat a lot of rice, a lot of yam, a lot of yuca. I don't want to blame people. A lot of bread, that's exactly what you do.
Correct.
And, and, and that glue is going to trigger a secretion of mucus. And you're going to end up with 85% of mucus in your digestive system. And you have a lot at different stages of your digestive system. Do you know that you have digestive hormones that your stomach is producing silently, that no one is aware of those activity taking place? But if you have a high proliferation of mucus, the mucus is going to block those receptors of those hormones, of those secretions, and that will interfere with the digestive process. So that's why a lot of people, they end up with gastric acidity, they have acid reflux.
Mm.
They don't understand where this is coming from. And because if you block the secretion of the hydrochloric acid. The hydrochloric acid cannot do the job of shutting down the bacteria that you introduce in your system with your food. No matter how much you cook your food, you still end up with a lot of bacteria.
Yeah.
And that's what God put in our stomach, the hydrochloric acid, to destroy those bacteria. Now, when you don't have a satisfactory level of hydrochloric acid, the bacteria coming from your food, those are not your friend. They're going to multiply in your stomach. Some of them will die. And when they die, they release what we call lactic acid. It's the lactic acid coming from your bacteria brought in by with your food. Those bacteria, when they release that lactic acid, this is the lactic acid that is going to attack the lining of your stomach, and that will cause gastric ulcers, and they will multiply, and they will use this is unbelievable. Those bacteria will use the wound to feed themselves, and that will increase the fermentation in your stomach. That's why a lot of people, they have bad breath because of those dead bacteria, because of the lactic acid and the proliferation of those bacteria that cause the fermentation. And
Yeah.
no matter what they do, no matter what they try, they cannot get rid of that bad breath. It's because of their eating habit. And there could be many factors there. You see, this conversation is very important. If you're eating in a way, if you're eating in a way, Natoya, that is not compatible with your metabolic profile. So the food that you eat will not be able to process it because you don't have the enzyme, enough enzyme to digest that food. So that food is going to linger in your stomach and cause fermentation and bacterial proliferation. So a lot of people, you go to the doctor, yes, you're going to put mail out or any type of antacid to shut down the and change the pH of the stomach because it alkalizes. The antacid is supposed to alkalize the stomach, but that's not what you're looking for because there are bacteria that can survive in a pH, alkaline pH. Ha! So you took that seed for our approach is totally different. Is totally different.
Yeah.
What we first we don't need antibiotics, but there are specific type of food uh, uh, that,
That
that
provides
we
it.
can take care. Yes,
Yeah.
yes, and you can use also specific essential oil. There are certain type of essential oil that will take care of your acidity in in a short time. I'm going to give one name. The name is Ravensara aromatica. Will ask me to repeat, but there's no need to repeat. They need me.
Mm. Well, you have to repeat it because we need to get it a little clearer. The connection kind
Ravensa,
of broke up a
Raven,
little bit.
okay. Ravensara aromatica.
Mm. So that's an essential
Ravensara,
oil that you're saying
Ravensara.
could help with digestive.
Yeah, yes, digestive disease. You have
Okay.
basil. Basil oil is extremely good for that.
Yeah.
You see, Oxymum basilicum, those are the Latin name. Oxymum
Yeah. The botanical names.
basilicum. I give the Latin name.
Yeah.
Ravensara. Yes, yes.
So based on
Uh,
what you're saying as well, Doc.
Ravensara aromatica, those are the scientific name. The scientific name and
Yes.
botanical name.
Okay. So we're having a little connectivity
Ravensara.
issue right now. If you're hearing me, Doc, you're breaking up a little bit. So just pause on all that information until we get you back clearer so we can share that information clearer. For those of you who are joining us today for the first time, of course, this is the first installment of Conversations on Health. We are live at Wilson's Music Center here in Maris Hill, Tobago, and we're talking to Dr. Keny Bastien. The conversation has been very interesting so far, just understanding some of the herbs that we could use, at least one herb, dandelion roots, which is a weed. It's an actual weed that we have growing here in Tobago that could help with so many different aspects of our longevity. Um, Before Doc, did we get him back? Yes, Doc, if you can hear me, come right back on. We were talking about the metabolic profile. You know, the question I wanted to get into as well is the science. Great, Doc is back. So, are you hearing me?
Yes, clearly, clearly, yes.
Excellent. So, well, let me ask that question one time because that was right there at the tip of my tongue. You know, just understanding the metabolic profile. You know,
Yes.
based on that, now there should be a science of eating that we should subscribe to as humans, based on that profile. Based on my understanding of what you just communicated, of course, you know, because sometimes we eat whatever, whenever, because we're hungry. And yeah, because we're greedy as well sometimes. So tell me what you think about that question, and how do you
It's a
agree?
wonderful question.
Yes.
It's a wonderful question. Everybody should inquire now when they come to you. It will be important for them to know, can you please reveal to me which profile I belong to? And according to their profile, now you can put together for them a dietary program that will be exact, appropriate for their metabolic profile. Yes. Do I
Yes.
make sense?
It does. It does.
So,
So I believe persons want to ask questions, some of our viewers. So we will open to that. Doc, how do you feel about that? I know this conversation could go on and on. We have about 15 more minutes into this first, about that, yes? To this
yes,
first,
we can try. We can
right?
try to
So
address
if
that
any
for them.
questions
Yeah.
come in within that time frame, of course, we would take those questions um, as generic as possible so we can share more with
Yes, go ahead.
persons, yes?
We can.
All right, so as you could go ahead in the meantime, Doc. As soon as the questions come in, I will be sure to let you know we have a question and we would take it from there. All right. Are you hearing me? Hello. Can you hear me, Doc?
I was receiving calls that interfere.
Okay, I
Can you hear
understand.
me?
I am
Hmm.
hearing you now.
Okay. Okay,
Right.
good.
So until we get the question, you were gonna go back to talking about the dandelion and the importance of including it in our diets. Yes, that's where you were heading.
Yes,
Yes. So let's
yes.
go.
The dandelion is extremely important in that sense that at the beginning we said, as the whole series, we'll be talking about common ailments addressed with simple recipes, things that we have at home in Tobago. We have cardiovascular problem. We have plant that we can use, and we can explain, we can emphasize, break them down. For example, we have seed under leaf. When you have seed under leaf all over the place in Tobago, and there is no need for people to die on dialysis.
And that's for the diabetics specifically.
Yeah, and we have
Yes.
so many things. We have so many things there, and the science behind that is extremely important.
Yes.
So that's
I
why
understand.
we we need we need to reach a stage where we have that conversation, and with that conversation we share the information the people need to use those plants and to get the full benefit of them. So that's the idea. So the dandelion is so important because when you suffer with a leukemia, dandelion is extremely efficient. And when you suffer with mononucleosis, that's what we call the kissing disease. Do you know you should not be kissing with because there is an exchange of bacteria in the mouth. You see, in our digestive system, in your mouth, in your stomach, in your duodenum, in your jejunum, ileum, and colon, you have a different colony of bacteria. So each time you kiss somebody, you agree to do a bacteria exchange. So you get in here is yours. So you better be extremely selective whom you kiss. But dandelion is there. Before you kiss, you can eat. You can eat few leaves of dandelion.
No, dandelion is an amazing herb. Quite some time now
It
I've been using it.
is
So you can also use the fresh herb as well as the dried herbs,
the,
correct?
correct,
Excellent.
correct.
So
Yes.
we
So
have a question as well. Continue.
and you have dandelion that is extremely good for people suffering from sickle cell anemia. when you have sickle cell anemia, you have to go to the doctor every basically
Every month,
every week. You have to go
every
for
week.
some
Wow.
people. Yes, you have to go for a blood transfusion,
Right.
and it depends the extent of the condition. Well, dandelion can fix that. So many benefits. When we have it, we should cultivate it, we should multiply it. And with the COVID shut down the activity of the graphene oxide. When you take the vaccine, the dandelion can reverse the side effect of the vaccine in your body. It's important to know those things.
Very good, very good. So let's also say good afternoon to the folks that are looking at us live across Tobago and Trinidad and Tobago over, as well as the folks in Haiti, in Miami, in Trinidad. Greetings to you, and of course, the folks that are live with us here on YouTube. Good afternoon to Len Phillips, Stephanie, Joseph, Lynette Johnson, as well as Spooky. Hello, Spooky. Thank you so much for joining us here. So we have a question. How do you prepare these herbs? And I believe the person is asking about the dandelion specifically.
Well, the dandelion specifically, you can use approximately 24 leaves of dandelion. You can use them raw. You can juice them. As a matter of fact, I encourage people, if you suffer with anemia, from anemia, you can use dandelion leaves, 12 leaves, fresh leaves, or 24 fresh leaves with beets. You put that in your blender, and I can tell you, this is the best
Powerhouse.
cocktail you can give to. Yeah. But we need, what I'm encouraging everybody all over the world, cultivate dandelion in your backyard. Do it, please. And when everybody is starving, there is no food. You have food in your backyard, and you can eat dandelion every day because it provides you almost the 90 nutrients that your body needs to function on a daily basis. And on
Right.
top of that, the dandelion detox your liver, and your liver needs the detox because your liver is busy every day from 11 to 3, 11 p.m. to 3 a.m. in the morning. The liver is busy cleansing your blood. So you should be smart to eat during the day to cleanse the liver.
Yes. Excellent. Another question. Or for the topic specifically, it's the person is asking, what can you recommend for sciatica pain in the hips and lower back?
Well, sciatica pain has a lot to do with the nerve endings. And most of the time, those people, they are depleted from vitamin B12. It's a deficiency. Sciatica has to do with the nerve endings. So you need B12, you need B6, you need B1, you need magnesium. It's a set of nutrients that your body needs. When you take them, automatically the pain shut down and the inflammation also goes away. And
Yes.
I would strongly encourage that the use of cat's claw, uh, that can help
Yes. And
tremendously
of
because it's an anti-inflammatory
it, yes,
non-steroidal.
I was not gonna say, and of course, with the combination of those vitamins, reduce the inflammation, the fried foods, the high cholesterol, the packaged stuff. Eat more fresh fruits and vegetables, right? Well, that's my contribution to this conversation.
Absolutely,
Fruits and
absolutely,
vegetables, fruits and vegetables. That's where the answers are. Everything that is living, you're giving your body living things as well.
absolutely, absolutely.
Excellent. Nice. So those are the
What
two
is
questions we
what
got so far.
what is the last question?
So those were the two questions we had so far. Um,
Okay, so let's go back to dandelion.
yes. Thank you so much
We
for your
we were
contributions and your questions, guys. Keep them coming.
yes, that's great. That's great. The dandelion is something that we should cultivate. We should pay attention to it. Because dandelion help us reverse any type of anemia, falciform anemia, a ferriprive anemia. Dandelion is extremely good when it comes to liver issues and lymphatic congestion. Here we get something extremely important that people should be thinking about. And the doctors are very frequently mistaken when it comes to the treatment of lymphatic congestions. A lot of people end up with lymphedema. Lymphedema, they have a swollen ankle, swollen knee, and the doctor make you believe that you have to be put on diuretic. It's not diuretic that you need because the problem has nothing to do with blood vessels. It's not your blood vessels that are congested when you have enema or fluid retention. You can have hydrolipidic fluid retention. So hydrolipidic retention means that your lymphatic system is congested. So if you're dealing with your lymphatic system, why do you address the blood vessel, the circulatory system? It's not the circulatory system. What goes when you go to any doctor for those edema and those congestion, they make you believe it's your blood vessels. That's not your blood vessels, and that's your lymphatic system.
And the lymphatic system is a very important, I mean, that's the engine. That's the
Yeah,
engine, really.
you see, the heart. Excuse me. The heart has its pump, and but the lymphatic system has its pump also. And the pump of the lymphatic system is called gastrocnemius. That's what we call your calves. That's why when you jump on your trampoline, you stimulate the gastrocnemius, which is your calves, and that make your lymphatic system flow. So a lot of people with swollen ankle, they should start jumping on their trampoline nicely,
Rebound.
softly at the beginning, yes. And there are other applications that other exercise they can do. We can talk about that in the future.
Excellent.
So this is for our first day. You see, what we just touched. There are so much to share,
A lot. So
and so
much. So
many
much.
simple. Yes, look at just one plant, the dandelion. How many answers we get already. So the need we have now is to cultivate the dandelion in our backyard and make sure that we eat at least between 12 to 24 fresh leaves of dandelion on a daily basis. You'll be amazed to see that in blood, the quality of your blood, that will improve the quality of your blood, that will detox your liver, and that will also provide you with all the essential nutrients that your body needs to function. The dandelion is food, so there is no need for anybody to be starving in Tobago.
Well, that's a hard thing to say, Dr. Bastien. I mean, it's easy for you, it's easy for me, but it might be hard to someone else. Dandelion, that's a rabbit food to somebody. You understand what I'm saying?
I know that's what I
Yeah.
call the cultural dietary pattern. The cultural
Yes.
dietary pattern is killing us. It's killing us
It is.
because,
It is.
oh, you should not eat this, you not should eat that. But why do we have a brain? The brain is to learn. You can
Absolutely.
change and learn to eat what is good for you.
Absolutely.
See,
And I,
this
I
is the
love how
need.
you started when you said, God wants us to win. He wants us to thrive. He wants us to be successful. And all of the information that is being provided here is to have a successful, functioning, flowing, thriving body.
Yes,
Yes.
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 This is
I love that.
power. God, God, God is God, and He wants the
Yes.
best for
Yes.
each one of us. And well, you are on the God side, you are on the winner side.
That's a chorus they used to sing in church. We have another quick
Yes,
question. The question is,
yes.
what do you recommend for varicose veins?
Varicose veins.
Yeah.
you need when if you have hemorrhoids. Do you know when you have hemorrhoids is varicose veins? That's the same thing than varicose veins. There is not one person with varicose veins that is not deficient in magnesium
Mm.
because the magnesium sustains the valves of the veins. So the valves collapse. That's why you end up with varicose veins. So the first thing to do is to strengthen the valves of the vein. All right. And from there, we can consider other options. But there are many reasons for that. The first cause of varicose veins is it can be genetic, it can be dietary, but there is one key nutrient that you need to take into consideration is lack of magnesium.
Yeah.
And other nutrients that is important is a vasodilator. You have cayenne pepper. Cayenne pepper is extremely important. So varicose vein has a lot to do. The first thing to do is to check your magnesium level. And magnesium is all over the place. Magnesium is in your nerves, it's in your brain, it's in your smooth muscle. You need magnesium for the contraction of your smooth muscle. Magnesium is in your heart. You cannot break down your carb if you don't have magnesium. Magnesium is one of the catalytic agents that make it possible for you to digest your carb.
Yeah.
So the question is simple, but the answer is complex. That means elaboration, and that means you need to have not everybody with varicose veins.
Have those deficiencies or something is wrong there. It could be hereditary, as I said, or part of the family, yeah, hereditary. Yeah.
No, not necessarily. It's
No?
dietary. It's
Dietary is the
dietary.
next word. Okay.
Yes, yes, it's
Yeah.
dietary. But everybody with varicose vein, they have magnesium deficiency.
Okay. Okay.
So that's the first answer. But that's not a sufficient answer. There is much more to it. That's what I
To
want to
find.
say.
Yeah.
Yes.
Excellent. Excellent.
I think we cover our time today.
Yes, we did. We did. It's always great speaking to you, Doc, and just learning and growing. And for those of you looking on and that will be looking at this recording, we will be here every Wednesday at 1:30 p.m. live. So share, imagine just taking time out in the middle of your day to just learn, to understand, to grow, to help yourself. I'm seeing someone saying, look how beautiful rabbits are. Absolutely. Rabbits are beautiful because they eat the greatest things created by the most holy one, and if it is we could understand how important these things created are for us, then we would also be wonderful every day as well. Yeah.
Absolutely. I
Yes.
thank you. I, I thank you so much for being here, Natoya.
No
And
problem.
as I said, it's a wonderful, you have a presence, a catalytic presence. You have a cathartic presence. Things must change when you show up. You have a cathartic presence. That's what I mean
I
by
give
that.
thanks for that.
And thank you so much. And I want to thank all our listeners that have been with us today. So we hope to see you next time.
Yes.
And in the meantime, may God bless you all and keep you. Thank you.
Excellent. Thank you guys. Take care. Next week, Wednesday, we're here, same time, same place. Get your notepads, get your pen and your pencils, and let's learn and grow together. This is Conversation and Health. It's the first edition, and we're starting here, but we're going up. We're going up. All right. So thanks again to Wilson's Music Center for accommodating us. This is the beginning of great things and great things to come. Have a great afternoon. See you next week.